Yeah. November 3, India, Mike.
Well, good morning, gents. I have WJ8B, N9OML, N5RTF, and N3IM. Check and thank you for joining us today. Howard, N9OML, would it be okay if the biographical data that you sent me with your application, would it be okay to sort of do a new member profile about you and put that down in the newsletter or as a maybe a link to a PDF version of it? Over.
Probably. Let me talk to you offline and we'll come up with a straight answer for that. Uh, Probably the best way to do it.
Great, Aaron. Let's pick it up in an email exchange. And if you would agree to be a new member profile, I'd like to get a photo from you anyway. I try to when it's a lengthy CV or information, what I try to do is just do a quick little summary, and then we'll put a link and put it on one of my addresses with a link to it that people can view. And one of my file systems, OneDrive or such. Thanks. We'll talk about it later. Any other early check-ins? AA4FL.
WA1EXA. You miss me.
Good morning, Mark. WA1EXA. Have you checked in? I also have just listening WA8YXM. Checked in here as well, John. Are there any other stations here? We're just about ready at the top of the hour. But any other stations for early check-in for the Marco Digital Voice Net Maker? And by the way, Hilton PY2BBQ has a link on the instant message feature from NetLogger for today's recording session. So you can see it in real time here rather than wait for the recording. We do appreciate Hilton doing that. Hilton makes a stalwart effort every week, does this. Sometimes he's down and still finds a way to get it done for us. But today he's on short time. I lunchtime too, so it's family phone calls here. It's lifetime. Thank you, Hilton, for doing that. We're going to put you in early in. So far, the check-ins are myself, Hilton, BY2BBQ, WJ8B, and 9OML, N5RTF, and 3IM, WA1EXA, and WA8YXM for listening only. Let me drop them. Well, good morning, or good evening, or good afternoon, depending on where in the world you are. Welcome to the Marco Digital Voice Net. This is AA4FL. My name is Jay. I'm the net control for the session, and the purpose of our digital voice net is to provide a discussion forum for current medical events and issues. Our Marco members act as topic presenters. We also allow guests who are not Marco members to join the discussions. So please, all stations, national and international, are welcome to join and participate in the discussion. I'm going to drop one. This is a directed net working from a login list, so all calls will be made through the net control, myself, AA4FL. We're keeping a session log using NetLogger, so you may look at it online if you download the NetLogger software and you have a Windows machine. And we certainly will get your check-ins posted. The net meets every Saturday at 1500 UTC. For housekeeping purposes, we are linked with repeaters throughout the region, the NATEM, and the servers for the QuadNet array. So with all this complicated connection of different machines and computers and networks, please make sure that you let the signals drop after the previous and then once you transmit, give it a pause so all these different servers can synchronize. Let me let it drop one. By letting the system synchronize, the transcoding can work properly, give everybody a chance to hopefully not have drops off the system. And if there are any stations now with priority or emergency traffic, please call Net Control. Four eyes at good morning, Jack. We have a check-in on KD4IZ, which I assume is regular. Are you going to be on short time today? Jack, are you available for the entire night? Okay, yeah, nothing heard, Jack. Maybe you missed the question. Regardless, let's go ahead now and have check-ins for those that are on limited time or mobile, and limited because of that. And certainly, Jack, if you're on limited time, just let me know. Any stations on limited time today on OPY2 BBQ fits that category. Anyone else make your calls at Net Control AA4FL.
This is Kilo 9, Kilo Whiskey Papa, K9 KWP.
K9 KWP, I have you checked in, Kevin. Thanks for joining us this morning. Are there any other stations that would like to check in? Go ahead and make your call. Okay, well, thank you, everybody. Before I go ahead to regular traffic, I'm going to give PY2BBQ Hilton, who's recording our session here today. He's one of two people recording. He's doing a YouTube recording, and then 5RTS Chuck is doing an audio recording. Hilton, why don't you go ahead and make your presentation here before we start our full roundtable discussion so you can get on with your day. Go ahead, Hilton.
Okay, A4FL and the group, this is PY2BBQ Hilton from Sao Paulo, Brazil. Nice to be with you again this week. This weekly meeting that is becoming part of our schedule every week. I'm sorry, this is my wife calling. She's like crazy because I didn't get to the club so far. She's waiting for me for lunch. It's 6 past midday here in São Paulo, so it's almost lunch timing in the Saturday. But yes, I'm for sure we are transmitting. We are broadcasting the net in the YouTube, like we try to do every week, even though we do not participate. I try to set it up and start and stop it remotely. And well, here in São Paulo, regarding the COVID-19 pandemics, we have a really a lot of cases of the new Omicron wave one. Because of such a large number of new cases. The hospital increases the number of beds occupied. My hospital had only 23 beds in the end of December occupied with COVID-19. Today it's 150. We have patients in the intensive care unit. We have patients with in ventilators, but we didn't have any deaths so far, at least in Albert Einstein Hospital. So, as we had already said, it's much more infectious, but much less virulent. This variant, probably also because of the level of immunity that our population achieved, as most of the population, adult population, is vaccinated with at least two shots of the vaccine. So, what I really think, wait, what?
A while ago. Andy, did you experience the same thing? Did someone drop off for you there, WJAD? If you type me a message, I'd appreciate it.
Yes, we did. And I think I already typed the message. Right after he started talking about Omicron cases, it was John here. He's on DMR or on D-Star or Fusion. I suspect he's on DMR. I'm listening on D-Star, so if anybody else is listening on DMR, they did not hear on this most likely a local problem. If they did, then maybe a climate problem. Back to you, Jay, on WJAD.
Thank you, Andrew. PY2BBQ Hilton, are you copying us? Go ahead.
Yes. Now I'm copying you again. I think my signal dropped. I'm transmitting via DMR, and I'm trying to monitor it in the internet to see if you are receiving it. And I didn't notice when my signal dropped. Oh wow! To summarize, we have a lot of new cases, including patients that had already been vaccinated. It seems that it's much more infectious even for those vaccinated, but we don't see severe cases and deaths in the same proportion that we had before. So hopefully it seems to be the ending of the pandemic and the transition to an endemic situation where new, more infectious variants arrive, and the people is already prepared, immunized, prepared for those new variants, and it doesn't end in the same kind of problem that we had in the beginning of the pandemic. So have a great weekend, you all. I'll keep on monitoring, but I think I won't be able to transmit to the end of this session. Thanks, Jay. Thanks, everybody. For FL, PY2BBQ.
QSL Hilton, I copied 100% of that, and we hope that we're getting close to endemic. I was doing some reading this morning, as many of you are probably doing as well, although that this seems to be the assumption and the trend. In reality, I guess there's still other possible outcomes. Delta could resurge back when Omicron's no longer here, or people that had Omicron wouldn't get quality immune response and still be open to other strains. So, it's certainly moving in the right direction. I just posted a link to a photo album. I was in Kiribati, it's pronounced Kiribati, it's pronounced Kiribati in 2013. I'm going to drop one here. Kiribati as a country is 24 islands spread out over about 2,300 miles. The most populated one, about half the population, is Tarawa, and actually Biso. There's numerous villages in South Tarawa. Biso is spelled B-E-T-I-O, the Battle of Tarawa from 1943. About 50,000 people in South Tarawa, a good portion of the population. And the island's pretty secluded. Now, they do fly in from Fiji to Tarawa. Some of the islands, other islands, do get flights. Not a whole lot of flights internationally. So they've been isolated and had no problems with this. Let it drop one. On our Google group, I was on our Facebook group. I distributed a link to a BBC article that talked about they have finally a number of people coming in from Fiji. Like 25% of the plane was positive, so they had 36 people, which I assume is Omicron, but just come in. They hadn't had COVID through now, but apparently 4 cases broke through containment. So they're going through that process right now, and they're closing down. But that's on the one island. The other islands, there's one 120 miles to the west of it. That's Mulliva Island, where I was on for the expedition. I spent time in Tarawa. I've been on one of the islands east Kiribati. Christmas Island I've not been on, but I was on Fanning Island. There's also the Phoenix Islands, which is central Kiribati. There's 3 different regions of the country that's cobbled together along the equator for 2,300 miles. I'm going to drop one. So if you're interested in that, you can read about it in the BBC.com. The article was not really fully disclosing the details. I went and looked at the public health ministry from Kiribati, from Tarawa, and I had been, in that building. And then when I went there, I had a license to practice dentistry, provided to me a credentialing through the hospital there. And that letter stated what they were doing, but in a lot more detail. And they said it was Biso, or that very western part of South Tarawa where the port is. That's where the World War II battle was fought. Red Beach is the inland beach on the atoll where the Marines came in at low tide, unfortunately, and we lost about 2,200 Americans in that trouble. Black Beach faced outward to the ocean, and the Japanese had guns there that they had taken from Singapore. And the Marines came in the other direction because of it. And I had a chance to collect sand from both Red and Black Beach because I was there for the 70th anniversary. They just got back from the T-30s and the expedition. That was in 2013. I collected sand and sent it to the War Museum of the Pacific, which is in Fredericksburg, Texas. And one of our MARCO members is a volunteer, including at that exhibit. He and I corresponded recently. Maybe let it drop. Also on the COVID front here locally, my father-in-law's independent living facility, 200 people, just reopened their dining room after isolating people for 10 days, keeping them in their room and delivering food because of Omicron. I went into the dental office here that I used to own, stopped for 2-3 days ago and talked to the employees. And when I went back 2 days later, they Henry had two of their employees out in Omicron. So spreading very quickly. I suspect that is probably the case for many health offices. My wife's radiography office had to reschedule her because they didn't have enough to do. As you guys, as we go through these rounds, maybe you can mention if you have similar stories in your locale. I'm going to drop them. Well, this is AA for the Medical Amateur Radio Council. Sorry for the long transmission there. Taking so much of the time at the mic. I do apologize that we'll go ahead and turn it over to the roundtable discussion now. And we'll start here with Andy, WJ80.
Well, good morning, everybody on the net. I'm coming to you from Fairfax, Virginia today at my Wilson's house. We'll have to be reserved this just 1-to-1 round today because I have a 4-year-old and 8-year-old grandsons here, and of course my son and daughter-in-law and my wife. So, as far as Ohio, there have been some hospitals that have suspended elective procedures. It varies widely locally. They're very busy. The hospital that my daughter works at is still extremely busy with COVID patients. Most of the deaths is the nationwide experience are non-vaccinated, and many of them are quite young, and many of those are usually quite healthy. So, I did listen to the EMRAP, that's a medical education company designed for primary care physicians and emergency physicians. Emergency COVID session that was live on, that was Tuesday evening, and that was quite informative. It will be available on YouTube during the next several days, and it's free. You don't have to belong to their organization. You don't get CME if you don't belong, but you're welcome to watch the entire thing. But they talked about several things, one of which trying to find criteria for when to innovate and when not to. And they had lots of different arguments. The bottom line ended up being mostly clinical findings and age of patient, et cetera. So the classic medical answer, it depends. So we also talked about some of the immunoglobulin treatments and differences, as well as new antiviral drugs. They also talked briefly about crisis care situations where house defined wheeling in different states. It is purely a local thing. Whether the hospital goes on crisis standard of care versus the usual standard of care. It's fairly interesting. About an hour or 5 hours, 10 minutes long if you watch the entire thing. But part of the ventilator discussion was at the very end, in case anybody's interested. So that's all I have, and that's good here, everybody. I will be listening for a while, but I won't be available for the second round. Back to you, Jay, from WJ18.
Andy, thanks for taking time on your travels to check into the net. Enjoy the family, and especially the grandchildren. Have a wonderful stay, and thank you for the report. Appreciate it. Howard, N9OML, go ahead.
Morning, Jay, and everybody on the net. The Chicago area and the state of Illinois are both in a bit of a quandary as to whether we've peaked or whether this is just something of a plateau. And I think we just need a little more time to gather data. I think they're optimistic, but the public health officials seem to be a little reticent to get too excited too early. We still have great strain on the hospitals. This time around, not only the patient load, but they're also having staffing troubles at some places due to infected staff.
Also disturbing, we had a governor's mandate for indoor mask wearing in public places, and many municipalities also put in requirements for proof of vaccination to the restaurants, bars, entertainment venues. And there's been quite a bit of pushback on that. One municipality has had to close its public library due to threats against staff for attempting to enforce the mask mandate. Numerous restaurants have been reporting on the news that they're just closed right now based on threats from the public when they tried to ask people to show them their proof of vaccination. So hopefully we are turning the corner, and hopefully in the aftermath of this we figure out what some of the authorities and public health officials and politicians are, and that politicians seek the guidance and follow the best advice of public health officials, and that our public health officials kind of get together on messaging so that they agree on a plan of action. As a midshipman, I remember Navy captain explained to us kind of a Navy maximum order, counter order, disorder, and I'm afraid we're creating some of that when multiple sources put out guidelines or guidance and then change them before we can even implement them. Anyways, just all my thoughts and observations from watching the news and doing some reading. And I know now, Max Net Control. G60. JC3 SOK, Kilo Charlie 3, Sierra Oscar Kilo, Jim, and Annapolis, Maryland.
Well, thank you. I have 3 additional check-ins. VE6DZ, KC3 OK, SOK, and WW6AA. Thank you for checking in. Is there anyone else that would like to check in at this time? I'd make a call to AA Fresno.
This is Whiskey X-Ray 4, Juliet Alpha Golf. Listening.
Well, thank you for checking in, WX4JAG. Thank you for listening. And by the way, if anyone's not a Marco member, you're welcome to participate in the discussions here. We do have the roundtable. I'm not sure if you wanted to listen or talk, but we'll certainly give you the opportunity to tell us that as we come. But hey, anyone else that's listening, please, you can go ahead and check in now, and we'll just let me know if you'd like a place in the roundtable. So WX4JAG, are you going to just be listening, or would you like to actually be on the roundtable list? Go ahead.
Thank you so much for the call back. I appreciate it. I will be just listening in. It's my first time tuning in to the next. I'd like to learn more about it. Certainly, I am Assistant Fire Marshal here in Broward County, City Mayor Martin, and I'm a firefighter paramedic. Just so happy to catch two other folks discussing an anti-pyramid type and listening. Thank you so much, and peace to all, and thank you for your service.
Well, thank you for checking in and thank you for your service. We appreciate you being there on the front lines. And the net here is the Medical Image Radio Council Digital Voice Net. We have another net, it's an HF net on Sunday mornings, which is rounds on the air. In Great Rounds on the Air, we discuss CE topics for CME credit. And there's also a few members in our organization with a COVID information net on 40 meters on their own there. The information, all this can be found on our website, marco-ltd.org. So we encourage you to read our newsletters and find out more about the organization. Thank you for stopping by. Are there any additional stations that would like to check in before we go down our list of roundtable discussion? Well, thank you everyone for being here. Quite an active group this morning. I'm glad the word's getting out that we're here. And next on our roundtable is someone very dear to Marco and myself personally, and he and his wife, N5RTF, Chip. Go ahead, Chip.
Hey, N4FL and 5RTF. Good morning, Jay and Annette. Don't have much to say today. I just observed that people have pretty much given up any thoughts at all containing particularly the Omicron variant of this virus. And there's just a sense of, go ahead and get it over with. People are going through the motions. They're following the laws and the regulations at work. But their hearts are not in it, and they're just really doing it for the sake of doing it, not because they really believe it's going to make any difference. In 5RTF.
Well, thank you, Jeff. I just hope those that are Cavalier are vaccinated, fully vaccinated, actually, so that they just get something mild that's manageable and not put themselves or others at risk in their families who are not vaccinated. Thank you for the description. I get the same feeling here in Hawthorne, which is a small town in Alachua County, east of Gainesville University. But when you get to the university, it's still full speed ahead on precautions, and that's very palpable. The radio station W4DFU is actually in the health center complex. So we get to live that firsthand whenever we go over there. Next on the list, N3IM, Keith. Good morning, Keith.
Hey, 4FL, the group is N3IM. I don't have a lot to say up here. We have improved our vaccination rate to 64% and 80% who have had at least one shot. Omicron is running its course here. It seems to have been decreasing over the last few days. As far as that goes, we're going to find out if super cold weather has any effect, because it was into the negative numbers last night, and it's only about 2 degrees now. So we're in a cold spell up here and along the East Coast, I guess as far as South Carolina. So we'll see what the cold does to this virus. Back to you, Jenny. This is N3IM back to 884FL.
Thank you, Keith. We'll be interested to get a report from you next week, and hopefully it's warmer, but you'll have a little bit of feel for what actually happened over this particular week as people reemerge from their houses. Thank you for sharing that with us. WA1EXA, Mark, go ahead.
There you are. WA1EXA is here. Well, hello everybody. Up in the Northeast here, we're pretty much, everybody agrees we're over the hump. We're getting our hospitalization and our deaths are dropping significantly. The state is reporting how many people are in the hospital due to COVID, and then how many people are also in for other reasons, and they happen to find out they have COVID. And it looks like it's about 50-50. So about 50% are in because of COVID. 50% are being picked up when they come in for something else. But we have been getting things dropping. Boston is still mandated masks and mandated vaccinations for going into public spaces. Drop one. In Massachusetts, town by town decision. The governor is not mandating anything, but the towns are actually, some are mandating vaccination records to go into restaurants, some are not. So it makes it a little confusing, but we just carry the card and the pass, we get it home. You were talking about those islands out there. We visited Kiribati, which was one of those islands, about 10 years ago or more, when they first started to get cruise ships coming in. And it was pretty isolated. Pretty isolated out there, had no air service. And it's so isolated that Japanese didn't even bother with that island. It was maintained by the Australians for a while. Now it's part of that island chain in that island country. And let's see, what else? I am going to be off pretty soon. We're going to be taking a trip to Norway. Yes, you heard me right. We're going to go to the Arctic Circle in the middle of February. And we'll see how things are up there if we can get there. We've been trying to figure out all the tests and things we have to do to get on an airplane. It's been confusing because it keeps changing every other day. So that's about what's going on here. And pretty much most of the schools are open, and I think that the results are about the same in Hartford, because I've been down there, and also in New York City seems to be on the other side of the curve too. At least that's what they're reporting. So back to you. Any questions? Just let me know. WA1EXA.
Yes, thank you very much, Mark. WA1EXA AA4FL. Mark, the BBC article, that talked about COVID escaping the containment was in Viso. So you were probably in Fanning Island from the way you're describing it. Some of the cruise ships went down there. It's about 1,000 miles due south of Hawaii. So a lot of the Hawaii cruises took 48-hour trips down there and back. And that one's pretty isolated. Probably won't have any effect from what's going on in Viso, but apparently they're shutting down all the islands. I think that one had a telegraph station, if I remember correctly, from the north side of the atoll. But you can look at the photos I posted if you get a chance. There's a link here on the instant message window. Thank you for the description of what's happening locally. I hadn't really heard statistics here about how many people in the hospital, which found that they had COVID for other reasons. Let me let it drop one. But that certainly makes a lot of sense with a lot of people not knowing, not having symptoms or having very mild symptoms which have already been vaccinated. Totally understand. Look forward to hearing more about. Be safe if you ice storm has its targets on you as well on the Cape. KD4IZ, Jack, are you with us here? Go ahead.
Yeah, good morning, Jay. Good morning, all. Hope you can hear me okay. Is the audio clear?
Yes, the audio is clear.
Well, that's a relief. I don't know anymore. We've had some oddities that have taken place, and I'm never sure. Just a couple of comments this morning. First of all, Maryland is like the rest of the Northeast. I'm just looking at the latest statistics here, as usual. Prince George and Montgomery counties are top of the list. Baltimore and Baltimore City also. Then it sort of peters out with the population centers, although there are some hotspots out in the surrounding areas that are worrisome, and these are areas that have a lower population density, but they have a very high percentage of activity. Let's put it that way. We've seen a little bit of a decline in the testing volume, but the rate is still very, very high, and it's hard to interpret what we're seeing there. I'll leave it pretty much with the comment that, for Susie and a lot of the other folks, Susie, my wife, and a lot of the other folks who are in the trenches, it's been pretty bad because a lot of auxiliary personnel, hospitals have been out sick on top of doctors getting sick, and that puts a real strain on the system. The ED at Sinai Hospital has been overwhelmed for quite some time now, and I know the docs there are strained. Pediatric caseload has been high in this area, and that I think is a worldwide Omicron feature, if you will. Let me drop it a second. For those who are not aware of it, Hopkins has not only their dashboard, which I'm sure everybody is aware of, but they also have a situation report that comes out of the Bloomberg School of Public Health, the Center for Health Security, and it's particularly well written. It's a nice weekly summary. Usually comes out on Tuesdays. This last week came out Thursday, of course, because of Martin Luther King Day, just prep time. Anyway, I will post on the chat for NetLogger the link, and Jay, if you want to spread it along from there, we'll leave it. I don't know what I got from here. KD4IZ, if I could.
So thank you very much, Jack. If you send that link to my email address, and I'll look it over and distribute that. Thank you for that information. I'm not familiar with that particular report from Hopkins. Sounds like it'd be quite useful. I see the link coming up here. If you can just send that over to my email address, I'd appreciate it. So I'll still get access to it. Thank you. And thank you for being here with us today. K9JWP, Kevin, go ahead.
This is K9KWP, Kevin, over in Palatine, Illinois. Not a member, not a medical professional, just an interested listener. This is the second time that I tuned into you guys. It's some interesting perspectives on what's going on. I think Howard provided a really good synopsis of what's going on in our area. And I'm about maybe 6-7 miles from where Howard is, and interesting, I grew up in Mount Prospect, Illinois, right across from Rockaway Golf Course, and went to St. Clair High School there, next door in Harmon Heights, so know that area well. But that's all I got, just listening in. Back to that. This is K9KWP.
Well, thank you for checking in and for letting us know some details about yourself. We're tickled that you're here and hope that you'll share information about the net with other individuals that you know that might be interested in the subject material. Of course, we're not always COVID related to that, but being that it's the predominant medical issue of the day, it gets a lot of discussion. The last few weeks have been very philosophical and talking about other aspects of COVID today. We have a pretty big group and haven't gotten into some of the parallel issues, things with the economy, things with mental health, other ways that families are affected. Last 2 weeks, and you're welcome to listen to the recordings. The links to that are on our website, and certainly can send them too. So, thank you very much, and please spread the word. Jerry, N4TSC. Good morning.
Good morning. Good morning to everyone on the group. I'm surprised that you called on me this morning because I joined late, doing some other things, and I guess the only thing that I can contribute is that it looks like there's more evidence that those who have been vaccinated have much better outcomes than those who have not been vaccinated, and those that are severely affected have been avoiding vaccination, and they come to the conclusion that perhaps they shouldn't have. We still have about 25% of the population in the U.S. that has not been vaccinated and boosted. And I guess the ongoing question right now is whether we will have a protocol for vaccinating those children under the age of 5. Obviously, we have to titrate their not only development of their immune system, but their weight, and try to figure out whether there's a different dosage per age and per development. And that's something that we're going to probably have to wait a few months for to get some kind of data. And in the lay community, there are arguments on both sides saying that some feel that under no circumstances should children ever be vaccinated. And on the other side, others saying, well, we don't know what the long-term effects are, but they probably should be vaccinated. So that's an open question, but it's not supported by any medical evidence at the moment. Anyway, that's the only thing I have to say this morning, and I will continue to listen. Back to you, JAA4FL and 4TSC.
Thank you very much, Jerry. I do have a question about the Wednesday night COVID net, the one that WB9 EDP runs, net control, assisted by you. What is the status of that net? Is it still meeting at the 0030 time? Over.
I have made myself available every Wednesday night at 0300 for this net, and on occasion Harry has been available, although he has not connected over the last 4 nets. And I did speak to him briefly on the phone prior to the last net. I just don't know what his availability is or why he's not there. He's mentioned that he's had some issues with his antenna system, and he expected to be able to hear. But I've made myself available for whatever time that he's around, and try to help out. And so far, it's been nothing over the last 4 weeks. Back to you.
Okay, thank you. I do want to confirm we're talking about 0030 UTC. Is that correct?
Yeah, that's affirmative. It's basically, if we're talking Wednesday evening, it would be 9 p.m. Eastern Time, 8 p.m. Central Time, that kind of thing. That equates to 0300 on the Thursday morning. Over.
Okay. So we're talking 0:30 hours, correct?
Yeah, that's correct. It would be, of course, with the shift in time, I think it probably is 0200, something like that. To do the calculation, but it's still Eastern Time, 9 o'clock Wednesday night.
Okay. I'll have an ether to print this. Want to make sure the correct information is in there. Still not sure, but thank you very much. We appreciate that, Jerry. Have a happy and healthy week. And thank you for the report. You're always on top of the science. Whereas here we're more on the practical side, not so much in the science. The Wednesday night is a whole different tone for those that haven't heard that. I think it's 7222, Jack. The question in JD4 is up. VE6, DZ, Gary. Good morning. Go ahead.
Yes, Victor Echo 6 Delta Zulu, Edmonton, Alberta, Canada. I have kind of a question, if I may. I've been kind of wondering, with all the people who haven't been vaccinated, and Omicron being the dominant strain, can they get a double whammy with Omicron and Delta, and which could end up fatal for those who are unvaccinated? How does that work? Or is it just Omicron now, which has a lot less severe outcomes? I'm kind of curious about that. It's been a question that's been weighing heavy on my mind. These and that control.
Well, thank you for the question, Gary. We have a few people that are more in the research realm respond to that. In a minute here, I'll let Jerry respond to it. But, Omicron, like I said, is 99% of the vaccination out of the virus now, the cases. But going back to, you say, the unvaccinated, I don't know if it's been established so much that the non-vaccinated have less of a risk. Certainly people that have been vaccinated are going to have a milder case, but I would still think people that are unvaccinated and get Omicron, regardless of Delta in the past, it's still a very serious offense, especially if they have any kinds of medical condition. Go ahead and, Jerry, if you wouldn't mind answering that in for TSC.
Yeah, and for TSC. It appears currently that Omicron is far more contagious than the Delta variant. However, it's less virulent. Therefore, the outcomes are a lot better with Omicron. The thing that we have not quite codified is what is the difference between the versions that we're getting now. We started out obviously with Delta, and then we have far more cases now of Omicron. However, in measuring whether we have the COVID virus or not, I don't think it's been distinguished in particular cases, in hospitalized cases, what numbers of Omicron and what numbers of Delta are still there. But bottom line is, if you've been vaccinated and boosted, your chances of survival are a lot better than if you haven't been. And seems to work in both cases, whether you've got the Delta variant or the Omicron variant. I hope that helps to explain things. Back to you, Jay.
Thank you for the explanation. Gary, did that explanation by Jerry help? Go ahead.
Yes, it helped to a large degree. I'm just kind of curious if you could get a double whammy of Omicron and Delta as well, to make it a knockout blow.
Well, I don't know if I have the scientific reasoning for that, other than there's apparently many more receptors on the Omicron virus, so that's why it's much more infectious. So we take 4 times as many antibodies to fight it off, I suppose, because you've got I believe at least 4 times as many receptors. So I would think that it would be saturating the receptors, thus blocking Delta from taking effect if it infected a person. But we just have to surmise that and not say that there's any scientific proof. Jack, Katie, before I said, if you're still here, what's your interpretation of that? Okay, nothing heard from Jack. Jerry, does that explanation or assumption sound reasonable with an Omicron infection tie up all the receptors, denying at least a Delta infection during the time Omicron was infecting the individual? Over.
I think it works out to be a matter of statistics and where you're likely to get hit. The Omicron, because of all of its tag points, seems to be an upper respiratory tract infection. It gets in the upper portions of the respiratory tract, whereas the Delta doesn't seem to catch at the upper respiratory tract and gets very, very deep into the alveoli, and that's what causes the significant illness. So the chances are, if you are just looking at it from an odd statistical basis, if you had all of these viruses thrown at you, about 80% of the time it's going to get caught in the upper respiratory tract. You're going to get the Omicron variant, and it would be a rarity that you would get maybe only 20% of the time it would get down into the deep alveoli and cause you illness. In any case, it appears that there's enough immunity that's developed by what are the neutralizing antibodies. If you get one or the other, it seems to prohibit you getting a second infection at the same time simultaneously. Now, there have been cases of people who have gotten the COVID virus, survived, and then gotten a second version of the COVID virus, but I don't know that we know specifically whether it's a different variant or not. That's about the best understanding that I have for the moment. Back to you, Jay, AA4FL, and for the essay, clearly not for terribly smart children.
Well, thank you, Jerry, with your modest phonetics there. But Gary, I guess in the long term, the history will be the judge. I think Jerry alluded to earlier that really we don't know from testing what each individual person has and which variety, which strain. So there's only a small sample that's actually checked. So I don't know how much surveillance is being done, but certainly the science will be out there eventually. So the answer to the question is probably one still being evaluated, and we're just surmising about what we think the probabilities or the likelihood might be. Thank you for asking a very stimulating and interesting question for being here today. We'll move on to KC3. That's okay. Good morning, Jim.
Good morning, and thanks for running the net. Very interesting net this morning with all the contributions really from all over the world. And what is amazing is whether it's Brazil or various places around the U.S. or elsewhere, everybody's encountering the same thing. You know, that the disease rate is up, seems to be starting to come down a little bit here in Maryland. We have the latest numbers are about 6.6% positivity, which is a little bit down from what it was a week or two ago. We have a high vaccination rate among people, 72%, and with only one, it's probably 80% or more. So that's been good. It would help us to get through the Delta without as much problem as many other places. But it certainly is packed in all the hospitals. As from Jack, I think, commented earlier, in the hospital that I work at, elective surgeries are being significantly cut back as the patients are having to be canceled and put on waiting lists. And that particularly affects, in my field, orthopedics, the elective spine and total joint surgeries. The same-day surgeries can be done at surgery centers or in the hospital and then discharged the same day. But staffing, as somebody else alluded to, is a significant problem. So the ability to do cases, you think about a number of people that may be out and how many traveling nurses, they can get. Traveling nursing has become a huge thing, and which causes problems all around the country because of the difference in pay of a traveler versus somebody who's there full time. So fascinating just to see the perspective and the difficulties people are going through everywhere and the commonality of it. Back to the net.
Jim, thank you for being here with us today, second week in a row. It is very important to hear your perspective as an orthopedic surgeon because you just brought up aspects of the situation that really, we haven't heard from that perspective. So we do appreciate that important contribution on the elective surgeries, being in a specialty that it would greatly affect the ability to do the hospital-based procedures. And also mentioning that even in those surgical centers, the problem is still employee staffing problems. And I would imagine that as we talk about that issue, just about all of us would have that observation in their own personal lives when they go to their dentist or their physician or their hospital, what they're seeing even in grocery stores. I think last week I mentioned I had gone into Walmart at 8 in the morning on a Sunday to be on the safe side. They were having difficulties with multiple people already calling in sick of staffing issues. So all across the economy, and that's where we got into the philosophical discussions about that last week. And all that's fair game, of course, for this net. So if we continue it on another day as a separate thread. Anybody that has a particular thread you'd like us to direct the net to, feel free to email me during the week at my QRZ address, and we'll make sure to pick up that thread when we get started. Meryl, WW6AA, early out there in California. Meryl, I know you had a lot of dropping last week, and you were on earlier and dropped. I just want to make sure to keep your transmission pretty short, and let me hear and make sure you're coming in fully. Go ahead.
Hey, Jay. This is WW6AA, and I will try and keep it short, Jay. As you're aware, it's now 8 o'clock in the morning, and so I'm still groggy waking up at 7 for your net, and I'm confused about COVID and trying to put it all together. Lots and lots of conflicting messages, ranging from my son that works at a safety net hospital who has already gotten his 4th shot. Anyway, I'll pass it back to you to make sure you're copying me. WW6AA first.
Yes, I am, and coming through just fine. You brought up another interesting concept because there's many of us that are already like 4 months out on our booster, and if they go to a 5 month one, we would be getting a fourth shot. So I don't know if the high risk individuals or if that means professionals, health professionals would fit that mold, but it would be coming into play here shortly based on the calendar if that was true. Go ahead again, Merrill. WW6AA, AA4FL.
AA4SL, WW6AA. Yeah. Um, anyway, I really don't know. I talked to several friends. I yesterday spoke to, well, let me preface it by telling you guys that I'm in my 80s. And so this is of concern to me. And as Jay is aware, we canceled going to Switzerland this year because of the confusion in Europe over how to deal with traveling from country to country. I really don't have answers, and my wife and I are very confused. We try to be relatively safe. It's, people are still dying in California. The population is split, and I think that the biggest tragedy of all is how this has become politicized. And the other one I can just share with you guys is the ships are still out in the harbor waiting to be unloaded. The number's up to about 110 today. And they recently have discovered that the train cars that are taking the containers are being robbed of the merchandise, so that'll slow the supply chain up a little bit more. Back to you, Jay. AA6SL, AA4SL, WW6AA.
Thank you for the description, Merrill, especially the Long Beach perspective. I guess those 110 odd ships are a little bit out, um, not crowding your view. And certainly can't step all the way across the Pacific on them if we're going to walk to Asia. But yeah, with certainly the inflation issue is another aspect of this infection. So the confusion, you know, I guess the science is just being written every day, and it's changing constantly. And electronic curveballs. So I don't know how the confusion can be avoided when you have many people speaking and making presentations on different levels, and then the press is involved as well. And you have reasons of many different types from a public health perspective and also from a commercial television perspective. So again, time will tell. There will be books written about this for decades. And let's hope we don't have another situation. Let me let it drop one. One of our listeners is using the instant message feature on NetLogger, so hopefully all of you have access to it too. And he's talked about the Supreme Court decisions in terms of businesses who can be mandated to have vaccines and the implications. Again, the questions go beyond just political. I mean, they're practical decisions too. So keeping people in the workforce, keeping the economy rolling. There's the layers and layers for just not sort of reflect on are there. KV4, as that Jack mentioned, also on the NetLogger list, that he had gotten some information per recent discussions. I'm not sure what IDFA is, but it must be infectious disease. That infant and child vaccinations might be just 3 to 4 weeks out. So take that under consideration and look for that in the news. It becomes more public information. So we're near the end of our list here. It's already past the 1600 hour when the net was going to conclude. I'll take, if there's any follow-up discussion, I will take a list from those of you that have something you'd like to follow up on. Go ahead.
N3IM.
WA1EXA.
Keith and 3IM, go ahead and take the mic.
Hey, 4FL, this is 3IM. Two comments. One is that we're finding out what federal agencies can do what, and that was part of that vaccine thing, that OSHA was not created to do health-related things, so they needed to find some other way to do that than OSHA. Number two, I recently posted an email on our bed use in Pennsylvania that came out of Hopkins, and we have open ICU beds in Pennsylvania as of 2 weeks ago. So coronavirus Omicron variety seems to be plateauing here, maybe even decreasing somewhat, and that's my comment. This is F3IM, back to A4FL in the group.
Thank you very much, Keith. We appreciate that emergency medicine perspective here, and having that information from you. It's very valuable. Thank you for participating. Are there any other follow-up comments before we call the net to a close?
WA1EXA.
Question. I'm on NetLogger now, 3.1.7. How do you send a text message on NetLogger? I don't see a way to do it back to net.
Okay, Mark, let me answer Jim's question first. So on NetLogger, if you're logged into our net here, the third blue button that says AIM window, AIM, is the instant message window, and that will open up the dialog box for you to exchange that information. Did that get you up and running, Jim?
Perfect. Thank you very much. Thanks for other than that.
Okay, thank you very much for participating, Jim. Excited to have you as a member and the contributions that you've made in the short term as a Marco member. It's very gratifying. That's what we exist for. You know, camaraderie, sharing information, and enjoying amateur radio, tying that profession to the hobby. We're going to go ahead before we call to a close. Let Mark go ahead and have his follow-up comment. WA1EXA. Go ahead, Mark.
Yeah, WA1EXA. I wonder, maybe we can bring this up next week because I want to start a whole nother discussion. There was a publication in PubMed that came out this past week of work that was done in Oregon by the School of Pharmacy and the Oregon Science and Medical University regarding the use of CBG and CBH for fighting off COVID, and that it was very effective. And well, I mean, I can go into it, but basically, I'm wondering if anybody had any comment on it, and maybe we can bring it up next week.
Well, that sounds like a wonderful idea, Mark. Why don't we go ahead and start on the Google group and stimulate and maybe put a link to that and ask if anyone has input and say I'd like to have a discussion thread on it next week at TVNet. Maybe that will drive some more traffic to the TVNet. Does that sound reasonable? WA1EXA, AA4FL.
WA1EXA. Yeah, I think that would be a good idea because we're probably going to get more information over the next week, I would think. So, I mean, it was looking like this was going to be one of the cures, but I don't know how it's going to work out. So, okay, yeah, I think that would be a very good idea, and we'll talk to you next week. WA1EXA.
Well, thank you, Mark, and thank you to everyone that participated on the net. And we've got multi-level ability here to communicate during the net. We've got the instant message feature, which I see more and more people are using now. And that's very effective to net control, who can help use that to direct direction and get everybody in the most important and prompt and interactive mode here. Because that way you don't have to wait for the round table for your turn to come up. So I encourage those of you that aren't using NetLogger that have Windows operating system to download it and use it. I encourage you to use the recordings that are made by N5RTF Chip, and also the YouTube recording that's made by PY2BBQ. Please share those with other hands. If you're listening, you're not a Marco member, I'd be more than happy to give you the links to those on YouTube. Just look up Medical Infrastructure Capital DVNet or Marco DVNet. There's a channel for that. You'll have those every week. And you share those with friends that might be interested. We're here, again, this is a meeting area for us. It's social as well as professional. Whereas some of the other nets that we do are strictly on continuing education. Here we're here to discuss medical topics, but with a little different vein. So we're more interested in hearing everybody's input and their perspectives, because it takes a community to get everything done. All these perspectives are important. Let's drop one. That being said, I'm going to bring an enjoyable session with the Marco Digital Voice Net to a close, and I look forward to speaking to everyone again next Saturday. I do want to make sure that the administrators of the QuadNet array realize that we appreciate their ability to offer us the technology, which they do courtesy and support it, to allow us to transcode and connect the Tower of Babel so we can all talk to each other. For amateur radio, it would not be possible to have the kind of discussions we're having if it was not for the transcoding ability that they afford us. Thank you very much. 730, we'll talk to everyone next week. AA4.
AA4FL and 3IM.
Hey, good morning, Keith. How are you doing today?
We're surviving this super cold weather up here. It's kind of unusual for us to get minus degrees in our county. I've been out when I was out working in western Pennsylvania. I got off at 7 o'clock in the morning and it was minus 21 degrees out there. But we rarely have minus degree weather in Clinton County for some reason. I just wanted to comment that I sent an email out a couple weeks ago with a link to that article from Oregon State, and I didn't know if anybody had really spent any time looking at it. This is N3IM.
Oh, thank you for letting me know that. I've been so busy with family getting everybody moved in up here that I must have missed that one. Thank you for sharing it. I assume you mean on the Google group. So I'll go back and look at the post there, Keith. By the way, I talked to Warren about maybe coming to Ham convention. I told him I'd drive down to Tampa and pick him up, take him to the airport, and drive him around. So he's non-committal at this point. So he hadn't moved out. But as of right now, we're still a go. I don't know if you got the second hotel reservation or not yet. I'm looking forward to that meeting, and I'm looking forward to spending time with you. I always have a good time together and with your group of friends as well. Go ahead.
Yeah, we're planning on being out there and getting the reservation taken care of that we can hopefully cancel. Yeah, Warren's on the. I can understand why. I mean, at his age, it's a difficult decision to make sometimes, particularly since his experiences with this COVID is not necessarily the best that anybody would want. that email you contacted me about, that I sent an email out to you regarding your high pitched squeal. That was on I think a Sunday net a couple weeks ago. So I don't know why that came up now, but anyway, I didn't hear it. I haven't heard you the last couple of weeks. So I don't know if it's corrected or not, but there was a really nasty squeal on your signal that weekend. So back to you, Miss Entry I am.
WA1EXA 0.
Okay, Mark, thanks for letting me know you're here. Keith, I haven't been on the HFnet since that episode that we had where I was hosting it that you left 2 months ago. So it wouldn't have been me if it was on the Grand Rounds net. So, but thanks for explaining. We do appreciate that. And again, look forward to spending time with you. Mark, go ahead.
Yeah, WA1EXA. Keith, what did you think about that article? I don't know what your comments were, and it's getting a lot of play out here. But I've only seen that one thing. PubMed is usually fairly responsible, so I mean it has some validity to it. Anyway, what's your comments?
WA1EXA Entry I am here. It's an interesting article. It seems to have some scientific validity. I put it on there for more or less, what do you think, to get comments back, but I haven't seen many comments come through on it. I think there are other studies out there on it, and I think it's worthwhile discussing. And I think that's a good discussion point for next week. I didn't even think about it. I just put it out there as hey, I saw this on the hemp products, and they have developed a anti-seizure hemp product, which is being used in the individuals who have a severe seizure problem, where they have 3, 4, 8 seizures a day, and it seems to be working. So maybe there is something in this article. This is Entry I am back at WA1EXA.
Yeah, well, it is a lot. It's very interesting because it would be a cure and also a prevention, according to the way it read. I did look up some where this is available. Both of those components. Of course, the price has gone up like 3 times since this information's out. But it is available. It's even available on Amazon. So we did look into how you get this stuff, and I'm not sure how you even take it. I mean, saw one was made of gummies, and somebody else has it as a concentrated liquid, and there's no dosing anywhere. So that's another question I would have. Like, so what's the dose? You just take as much as you want. I don't know. So it's a lot of questions, and but it looked very interesting. So we'll see what happens if anybody else has got any other information, or somebody else comes up with something during the week, and we can kind of review it. Back to you, WA1EXA, and Jay, don't just sit there and say them.
Yeah, well, the CBD products have been on the market for some time for various other reasons, and showing some response in some people and some response in other people, but some people with no response. Dosing wise, I don't even begin to know what dose you would use.
and it does come in all kinds of forms. I mean, it's interesting to see, but I know I believe the one they're using for seizures is a oral liquid, but it seems to be working well. Probably would work in any formation, and they're coming up with all different kinds of ways to use CBD. So even to the point of vaping CBD. So we'll see what happens. I'll do a little more literature search on that one for next week. This is N3I. I'm back to the group.
WA1EXA. One thing I did find out, I'm not sure where I saw it, is that they're claiming that the product CBD is a down the line version, that doesn't work for this reason for COVID. It's a precursor, the two precursors of CBD that you have to get. So CBD itself that they're selling everywhere is inactive. But the precursors, those two, GBH and GBG, I think it is, or CBH and CBG, I guess that's it. Are the ones you got to get. So it's another piece of information that I found someplace, and doing a little more research on this side.
Yeah, well, I'm going to delve into this a little bit deeper during the week here and see what I can come up with in terms of more information. But that article, I think, was a good way to start. And that's why I put it out there is, well, what do you think? I didn't actually make any comments about it. And they have, it came out of the College of Pharmacy out there at Oregon State, so I guess we need to find out what their, they didn't include any references in that particular article. It'd be nice to know what their references were to it to get it started. So, and even more interesting than that is they're using hemp for so many other products now. It's amazing, and we'll see how that works out. But it's interesting how these compounds are being formulated and how certain organizations that are involved in, or companies that are involved in this research are making headway in its use. So maybe the fact that it was native to America and the American Indians used it for many different things may prove to show that sometimes ancient civilizations can give us a lot of information about other things. It's kind of an interesting concept. I'm gonna go QRT now. I got things to do, and we'll talk with you later. WA1EXA, A4FL, this is N3IM.
I have to go QRT as well, guys. Have a great week. 7-3, AA4FL QRT.
Okay, guys. We'll talk to you next week. WA1EXA.